Hello, I'm Dr. Leo Vela. I'm the Senior Associate Dean for Education Resources, and I'm also the Senior Associate Vice President for Education in the Division of Health Affairs and professor here in the School of Medicine.
My name is Rachel Boren, and I am a fourth year at UTRGV, and I'm part of the inaugural class that is graduating on May 9th. And in this interview, we are going to be talking about the journey through medical school and how it was being part of the first class and reflecting back on that.
So Rachel, that's it's been a road of 4 years. I'm thinking back to the white coat ceremony, and I'm sure you remember that pretty vividly. And I wonder what you were thinking back in the white coat ceremony, and then now 4 years later, if you can just sort of reflect on that.
Yeah. So when I went to medical school, I actually had never been south of San Antonio before, and I had heard from like professors that had been physicians before, and they were like, oh, medical school is like its own thing, you know, studying is stressful, but med school is like a different kind of stress. So I remember going in like very, very excited and not really understanding what they were talking about. And I think on the other side now, I sort of understand maybe what they were talking about. But what they failed to talk about with the stress was the amount of growth that I think happens when you're in medical school, and how much you change from being fresh out of undergraduate to like entering a professional world. And I, for some reason, had in my mind that like, I guess I didn't need mentorship as I finished undergraduate. And then I got to medical school and I was like, this is incredibly important. And I had really great people when I was at UTRGV. It was like Dr. Nelson, Dr. Malene Sanchez, excellent mentors that I had along the way that I think really got me from point A to point B, and I didn't even know that like growth needed to happen. So I think during white coat ceremony, I didn't have a firm grasp of what medical school meant in terms of growth as much as I did in terms of like academia. So that was really cool to end up seeing from that point when I started to now, like how much has changed.
So just a follow-up question to that, Rachel. You're obviously preparing for residency. So maybe a few words about sort of your process for choosing a residency and what you're looking forward to in terms of starting your postgraduate training.
Yeah, so I applied to pediatrics over my fourth year of medical school, and I matched into UT Houston for pediatrics. And so I was looking specifically for an academic program because I'm kind of looking to do the fellowship route. And so high volume, and then also has a diverse patient population, which is something I was really well exposed to in the Valley. And so I'm really glad for that experience because I know what it's like. And I picked up a little bit of Spanish, which is really helpful.
Well, I just wanted to say, just as an addendum to that, certainly the leadership of the School of Medicine, Dr. Krause, the faculty are just so excited, proud of our charter class. You all have, it's something that we've looked forward to so much. I will have to say that this whole community has looked forward to seeing this graduating class. It's really been, Rachel, a vision, a dream that the Valley community has had for decades, for a long time.
I'm hoping that they celebrate this much every year. The community does, because the whole medical school class really wouldn't have been there apart from the community and the preceptors we had and the people who put the medical school together. So I'm kind of hoping maybe every year, even if we can't do it for this inaugural class, that there's some type of community involvement, because it's sort of all owed to like our families and the community that, you know, gave us this opportunity in general.
There's so much support for our medical school across the Valley, and Dr. Krause has done an excellent job in his leadership role to really get our medical school visible throughout the community and in all our components of our mission and education and research and clinical service. And and service itself. I know you all had experiences on the service side here and different experiences in the Valley.
That's actually something I would like to thank the community for also. They were so willing to take in medical students. Because we were the first class and they hadn't really been exposed, and I was never like kicked out of a patient room. People were very willing to be like, yes, come learn. And it taught me a lot, because when you go down to the Valley, I distinctly remember being in a colonia where we had set up a clinic, and it reminded me of a mission trip I'd been on, because we were in like a building that had no AC, and it was just kind of a schoolhouse that they had stored stuff in, and it was the only place we could see patients. And I remember thinking, if I saw this patient in a clinic, I would never know that this is where they had lived, and this is what they were coming from, and this is who they were as a person. And it made me like realize I take a lot for granted, even when I'm seeing patients and like taking their history. It's not the same hearing it in a clinic as it is seeing where they're living. And I think that experience is invaluable, and I wish that everybody could get it that was going to become a physician, because it teaches you so much about compassion. Even you can cerebrally think of compassion and tell yourself you're a compassionate person, but having those experiences really brings it like to your heart. And so
it's great to hear you say that, Rachel. It really is, because we owe so much to our patients and our community. They are also our teachers. So, and I wanted to sort of ask a question about sort of the rest of your class from this standpoint. Is we start out, obviously, a lot of medical schools classes are in the 200 range, and we have a much smaller class at right now that we're starting in these formative years of our medical school.
Yeah.
But my sense, Rachel, is that having that smaller class, and I've seen this and with your class and even the classes that have followed you, that there is a real sense of camaraderie that develops, and my sense is that is going to be lifelong. That's I think that having gone through the medical school experience together, that as you graduate, that camaraderie that you've developed, that professional association that you have and friendship, my sense is that's going to be lifelong. What's your sense?
I remember it being a little scary when I moved down there, and there was only 55 of us coming from like a big university. I was like, I don't know how this is going to go. And we showed up, and I think that there was a super strong sense of camaraderie, and I think it pulled a lot of us through. Like, I think that the reason some people were able to make it through is because they had support from like the students around us. I know I have a close group of people that I talk to every day that have taught me a lot when you're open to it. And then I've also seen them experience like really difficult things going through medical school and push through. And it's really an inspiration. So I think being able to go through similar things with this group of people, yeah, it's medical school and like those people are friends, but ours being a first class and having such a small amount of people and it being a new experience was really a different molding tool. And I think it drew a lot of people much closer to each other. I'm sure people have lifelong friends coming out of this, because I know I do too. So,
well, I think that what you mentioned earlier in terms of that, seeing the class progress from, I told you all that when you came in, you may remember, but I said, you're going to learn a new language. Mm-hmm. You're going to learn the language of medicine. And I said, how do you learn a new language? And the example I gave you, I said, do you remember that if when you were as a child, you really never sat down to read a book of how to speak English or Spanish? For me, it was Spanish, my first language. We learned it by being immersed in our culture, with our family, with our friends, by hearing and being immersed in that culture, if you will. We learned our language, our first language. In a sense, medicine has some similarities. I told you all, you're going to learn a new language, the language of medicine. And some of it you're going to learn by reading and being immersed in reading. The other is going to be just by being in this environment. So what would be sort of your words of wisdom to those students who are now, say, thinking of medical school, or an undergrad or even high school thinking of a future in medicine?
I tell this to anyone who talks to me about wanting to go to medical school. I want you to have a very full understanding of what it means to go into this new medicine, because it is very different. And I don't know if people always understand what that means. This pandemic has shed light on medical education, it's shed light on residency training, it's shed light on healthcare in academic settings, all the way up through private practices. It's shed light on where our failings are, and where we definitely need to step up and improve. And that goes for everything from Medicaid funding through the way private insurance operates. And these are all things that I hope everyone learns to invest their time in to learn about, because medicine is no longer being able to get by, I think, with just learning material and sort of sticking to ABC. I think now it requires somebody who's willing to speak up, and somebody who's willing to go lobby at the Hill or have a firm understanding of what they stand for, because I think so much is changing, and if you just sit back, you'll wake up one day and it'll be not at all what you wanted it to be. So I think that I try to tell people to be well-rounded, to read and write more, to gain an understanding of literature and politics and political science and economics, as well as your medical studies, because it's not enough to just do medicine anymore, because you're not serving the patients to the best of your ability. Because it really requires advocacy and being vocal, and it requires restructuring maybe your practice and the way that you interact with insurance companies in general. So I try to tell people, I'm like, you're heading into a type of battle that you maybe aren't anticipating, and it's well worth it. It's the only career, I think, where you can wake up in the morning and know exactly what your purpose is every day.
A real blessing to get to spend time with students in clinical skills now and get to see them develop, learning the language of medicine. But with your class, it was really I would go down the hallway and I enjoyed doing this, just getting to visit with students and just to listen to them and be able to even learn from them. We, as faculty members, we also learn from our students. It's not just one-sided. We learn together. And that's why we emphasize lifelong learning. And we haven't talked about that, but I think that's something that you that's been our focus in our education, is to prepare you as students to be lifelong learners, because medicine is evolving and transforming at a rapid pace. And you know that well, but I just wanted to say, as I conclude, that it's been really, and I speak from all the faculty, and that we wish you and your classes, your classmates, and the absolute best as you proceed in your residency and in your profession and your practice. And you will always be the charter class of UTRGV School of Medicine, the first alumni of our medical school. And we look forward to hearing great news about all of you. And I know, as I said, Dr. Krause, our dean, and the whole university and the Valley, we are very so proud. And again, look forward to May 9th. We plan to have our virtual graduation set for May 9th, and look forward to that very much.
I'm very thankful also for the virtual graduations taking place, that we were able to put something together quickly. And I look forward to being part of it and seeing everyone there. I'm really thankful for the time I had and the leadership of the medical school that got us through this whole thing and provided us an opportunity to do medicine and become physicians.
Okay, Rachel.
Yeah, thank you.
Thank you.
Mm-hmm.
Take care.